Well, for more on where the U.S. stands in the fight against the opioid crisis, I'm joined by Andrew Kessler. He's principal of Slingshot Solutions. Andrew, thank you so much for being here. President Trump really campaigned on reining in this crisis with opioids. How do you think in the last 3 years, how do you think that he's done on that front?
Well, the White House and President Trump have done a lot to keep this issue in the forefront. The president appeared in Atlanta at a very well-attended summit, the National Prescription Drug and Heroin Summit. He was the second sitting president to attend. President Obama also attended when he was in office, and past President Clinton attended just last year. So the fact that he's keeping this issue in the forefront, we're all very grateful for that. But he has a very good partner in Congress as well. Mm-hmm. Congress has really been pushing this issue even long before any White House did. There were champions in Congress that were paying attention to all issues of addiction. So the president has been working closely with Congress on many of these initiatives, and they've been keeping the issue in the forefront, but there's still a lot left that they can be doing.
What do you think they should be doing right now then?
Well, the one area of investment where I don't see enough is in prevention. There's a lot of investment going into treatment, and there's a fair amount of investment going into reversal of overdoses, as we saw with naloxone. But the key to fighting any disease is prevention. Whether you're talking about cancer or hypertension or diabetes, addiction is a disease. Substance use disorders are a health disorder, and prevention is always the best line of defense. So I think a lot of advocates would like to see a lot more attention paid to prevention efforts, and not just in terms of advertising or messages, but looking at the root causes of addiction, like trauma or adverse childhood experiences, and how we can address those to prevent people from turning to substances later in their life.
We've seen so far in the race for 2020 that healthcare has taken a very prominent role. But do you think that the opioid crisis itself is going to play a big role?
That's tough to say. I do know that when there was debate over health care just a few years ago with the Affordable Care Act and Medicaid expansion, the opioid epidemic really did play a central role in that. There were a lot of advocates for expanded health care who pointed to the opioid epidemic and said, this is a public health issue. And the president himself, when he declared his emergency, declared it a public health emergency. So you have to understand that opioid abuse is not just limited to the disease of addiction or to substance use disorders. It causes other public health problems, whether it be hepatitis, HIV, it could be MRSA infections. There are tremendous number of cases of endocarditis reported because of intravenous drug use. Medicare spent $900 million on that issue alone just in 2017. So it really, the public health impact of the opioid epidemic goes far beyond just the disease of addiction, and it really does encompass all public health. So it really is a relevant part of the discussion.
Yeah, and I think that people probably don't realize, because it spreads out so much, that the cost is quite high. So the White House Council of Economic Advisors came out with a report, I think it was just last week, and they said that the opioid crisis has cost the U.S. economy nearly $700 billion in 2018. So that's 3.4% of GDP. And in a 4-year span from 2015 to 2018, it was $2.5 trillion. Do you think that the number is that high? And if it is, why is Congress only throwing out $8 billion at this problem?
I do believe the number is that high because I've seen similar numbers for other forms of substance use disorders. I've seen similar numbers for alcoholism, and this is not the first wave of a drug epidemic we've seen. We've seen problems with methamphetamines. We've seen problems with crack cocaine in the 80s. So I do believe those numbers because you have to take into account not just the cost of health care, but lost productivity in the workplace, property damage from driving under the influence, court costs, prison costs. This is a rare case in public health in that there is a criminal justice aspect to it. There's no criminal justice aspect to hypertension or diabetes or lupus or any other disease you can think of. So that really does drive the cost up. So it's not surprising to people who work on this issue that those numbers are so high.
All right, so getting back to 2020, we have Elizabeth Warren. She has a plan for just about everything under the sun. She also has one to fight the opioid crisis, $100 billion, has 10 times as much as Hillary Clinton was throwing towards overall drug addiction programs when she was running a couple of years back. Do the other candidates have similar plans, and how is this going to play out with voters, you think?
Other candidates I haven't seen as comprehensive plans on paper, but I do know that they are attentive to the issue. When Mr. Biden was a member of the Judiciary Committee, he was working on this issue, both from a treatment and from a criminal justice perspective. I believe that other candidates have actually, there are one or two candidates who have endorsed Ms. Warren's plan, and there's so many candidates I'm going through in my head. But in terms of a comprehensive plan on paper, Senator Warren is first out of the gate, and the CARE Act that you refer to was co-authored by the late Mr. Cummings as well. So it's unfortunate he won't live to see that possibly advance. But a lot of advocates in the field have said, at least, you don't necessarily have to come out with a competing plan. You can either say parts of Ms. Warren's plan are good or can be improved upon. But in terms of legislation, I believe actually Ms. Klobuchar has also authored some legislation, but it has much more to do with the criminal justice side because of her past as a prosecutor.
All right, thank you so much. Andrew Kessler there from Slingshot Solutions.